Thank you everybody for coming this morning. If you join us for a short prayer. Gracious Heavenly Father, thank you all for all the blessings you have bestowed upon us. Dear Lord, we thank you for this opportunity to be here this morning and lead the county. We pray, dear Lord, that the decisions we make today would be the best for the most people, and those decisions will be pleasing unto you. Dear Lord, we ask you to lay your hand upon our law enforcement officers and help keep them safe. And we ask these things in Jesus' name. Amen. Amen. We declare this meeting open. If you'll join us for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Did you hear all these people? Yeah, that's good. The minutes of our last meeting have been circulated among the commissioners. I'd entertain a motion to approve the minutes.
I'll make that motion to approve.
Second. All in favor? We also have a claims docket that's been circulated among the commissioners. I'd entertain a motion to approve the claims.
I'll also make that motion.
Second. All in favor? We also have a payroll that's been circulated among the commissioners. I would entertain a motion to approve the payroll.
I'll also make that motion.
Second. All in favor? First new business this morning is Community Corrections, Department of Corrections grant.
Good morning.
Good morning.
It is that time of the year again that we need to submit our application for funding from the Department of Correction. Our grant this year is the same as the last, I'm going to say 15 years, because I don't think we have received an increase in funding for that long, maybe close to that. It's $680,923. So I'd ask for you to approve us to submit that grant so we can continue running our wonderful program.
I would entertain the motion for support of the grant application for Community Corrections.
So made. Second.
All in favor?
And I will need you to sign, please.
What's the logic that they never increase it? I don't understand that, what they're thinking there.
They're building a new prison.
Okay.
It's all the same money.
But you would think that they would think local expenses would be up.
Yes.
I think that they would think local expenses would be cheaper than them spending it. But yes, I think that's the reason that you don't need to increase it, because the local expenses are cheaper.
Oh, okay.
If you all don't mind, I'm going to put the date on it.
Great.
This is no April Fool's joke, right?
Yeah, no.
Nope. Not yet.
Thanks, Larry.
Next we have the Magistrate Court Services Agreement. I think Marvin, we'll take care of that this morning.
If that's acceptable, yes. The magistrate has a special case requiring a level of research that he doesn't ordinarily need or have time to do himself. He's been working with a law student through it's a rural communities initiative that places law students into rural county seats. And so that individual has already served courts, and the judge is familiar with his capabilities. He would like to hire the student as a contractor, so the student would get a 1099, a maximum of 25 hours for a research project at $20 an hour, a possibility that the judge could move more money later if more research is needed, but the initial project scope is estimated to be 25 hours maximum. Let's see. Any questions?
The judge does have this money in his budget, correct?
Thank you. That's what I was reaching for. The money is in the budget. He will ask the council to allow him to move across categories, but that's no big deal. The money is there.
Questions, comments?
Seems like a bargain to me. Is he going to do that remotely, Marvin? They won't actually be on site, is that right?
I'm sure that a lot of the work will be done at the law school library and through electronic means.
Okay.
I don't know if the student is still coming back and forth to the court at this point, because I believe he may be doing something this semester with the courts in Monroe.
We're not going to need to provide any space or anything? No. No, I think that's a good deal.
I would entertain the motion to approve the magistrate court services agreement.
So made.
Second.
All in favor?
Thank you.
Thank you. IT department, assessor data migration.
Morning.
Good morning, Michael.
So I'm bringing a quote, the work involved, and we need to move a old database that the assessor's office still accesses from time to time. It's currently on a really old server. It's slowly going out the door, so I'm just trying to get everything off of it and migrate it onto a new server. The total amount quoted is $500. I have it in my budget, and I'm just seeking approval, but it's such a small amount, but it's handling county data, so that's just kind of why that we were...
You say there is a server in the assessor's office?
No, it's a county server.
Okay.
Yeah. I've just been getting stuff off of it, all on new equipment, trying to bring out all the old stuff still.
Okay.
I don't have any problem with getting that all cleaned up the best we can, especially with the new internet that'll be coming in. So I'd entertain a motion to approve.
I'll make that motion to approve.
Second.
All in favor?
Thank you.
Thank you, Michael. Next, we have a letter of support for the Westgate and Greene water and wastewater expansion. This came from SIDC, is working on a grant opportunity for Crane Village to get that whole process cleaned up that they've been working on for 20 years probably. So, Marvin, you got anything to add there?
Just very quickly, the money that's being sought through this is actually part of the continuing resolution that was passed, but that's going to be tied up for a while. And so the attempt here is to attach this to another piece of legislation more likely to pass more quickly. We're trying to find that piece of legislation and to enlist Representative Messmer's assistance in doing that.
Questions, comments?
No, we need the money. We're not going to be able to do the work.
I'd entertain a motion to approve the letter of support.
So made.
Second.
All in favor? Next, we have the Greene County EMA generator maintenance agreement. I don't know if Roger's not here, but this is probably their standard agreement renewal.
It is, but Also, I know that the maintenance supervisor is trying to get quotes for maintenance of all of the generators in the county on a uniform quote, and indicated that he would have that by the next meeting. It might be worth holding off and seeing if that quote is better than what's here. This is the vendor that Rogers worked with previously. I know that the vendor that the county is using more broadly, if I recall the contract correctly, provides more services and more maintenance at a very reasonable price point.
Do we know if his generator has been included in that quote?
Yes, it will be when Tim gets the numbers together and has them at the next meeting.
My preference would be we just have one vendor that's doing that.
Yeah. I would move the table until next meeting.
You've got a motion.
Second.
All in favor? Next, we have Greene County Economic Development Corporation Annual Services Agreement. Good morning, Brianne.
Good morning, how are you guys?
Good.
Sorry for being late today.
I wasn't going to shame you for it.
Well, I didn't mean to apologize.
I was really struggling with not shaming you for it, but
I can tell. I reviewed the annual services agreement, and there was just two changes that need to be made to the names of the president and secretary. But I'll give that to Marvin before I leave for today. It's pretty basic, the same as what we've done before.
questions, comments?
It's a service that we need. Glad she provides it.
I'd entertain a motion to approve the annual services agreement.
So made.
Second?
All in favor? Thank you very much. And it just worked out this way that you get to stand at the podium and didn't have to go back and sit down.
Yeah, it's handy. Okay, I'll provide the same update I gave to the county council last night, that Nate and I met with the developer, met with Simon with Acme on Friday afternoon to discuss next steps and what do they need from us and what do we need from them so we can move forward. It was a good meeting, and
Very good.
Simon gave Nate and the counties kudos for, I think they were further along than what they thought we were going to be in the process. So there's just a couple of items that we need from them, and we will get that whenever Kratos is back in the picture. They're out of the country right now, but in a couple weeks, they should be working on it.
We'll meet with them again in 2 weeks, soon as they get their schedule put together.
Yeah.
I think, and that's gonna be an ongoing process. I think we're gonna have a meeting every 2 weeks with them, just to
Okay, good.
keep
Start pulling
everything.
in utilities and, make sure that, just have team meetings as we move forward. But yeah, we told them we did entrances and driveways, and then wastewater usage. So hopefully get that soon so we can get going. But do you have any questions for me?
Nope, just keep us in the loop.
Yep.
Yeah, of course. And of course, GCDC has a housing committee that's been pretty dormant the last couple of years, and with the help of Bloomington Board of Realtors, we're going to kick that back up again.
Good deal. We're gonna need it.
Yeah, we are. All right, thank you guys.
Thank you. County Attorney, Marvin, you have anything for us this morning?
Just looking toward the future, as I circulated to you late yesterday, there was a need yesterday for me to take a look at the capital improvement plan, which is associated with edit spending. And in doing so, I noted that that document would expire at the end of this year. Also noted that there is at least one change, if not more, that should be made to that document. Just wanted to get that on your radar and to get a sense of how soon you might actually want to try to address that document. Do you want to put it off to the latter part of the year? Do we want to go ahead and get it done the first half of the year? What is your preference?
I know, I read it last night. I didn't realize it'd been that long ago that we did that.
I didn't do it.
I didn't either.
Yep, almost 4 years.
Yeah, well, we don't want to wait till the end of the year.
No. My thoughts are, I think everybody knows, we want to just go ahead and get it taken care of, and not put it off.
Right.
Something else will come up by the end of the year and push us back, so.
I'll be in touch about thoughts on modifications and additions then.
Yeah, it does need to be updated, I'm sure.
And that's the only thing I have this morning.
Thank you. Do we have any elected official or department head comments this morning? Have any public comments this morning?
Yes.
A group comment.
Give you guys copies, and we have stuff that we're talking about. Good morning. I am Emily Bach, and I am over the Fetal Infant and Child Fatality Review Program here in Greene County, as well as 6 other counties in an area that we call the South Central Region. I have been in this role for 5 years here in Greene County, and I just wanted to share some stats and some things that we've learned over that time. So there's a page in there that lists our infant and child fatality rates for the county. For infant mortality rates from 2018 to 2022, Greene County's rate was 7.9, which is the second highest in the region. From 2018 to 2022, our child fatality rate was 7.7, which is the highest in the region, the highest by far. There are some other statistics in there. Our child abuse and neglect rates are 4th in the county. 52% of our removals are due to parental substance use or alcohol misuse. And then our suicide rate here in Greene County is 3rd in the region at 19.4. I share this information with you just to bring to light that Greene County does have a mental health crisis. It is literally killing our children. We have the highest child fatality rates in the region. So I just wanted to bring to the attention our lack of access to mental health resources. One of the things that we see a lot in our child fatality and infant fatality review is the lack of prevention home visiting resources. The state of Indiana receives Title V funding. It's a block grant from the federal government to provide maternal and child health resources. The state of Indiana decided 25 years ago that prevention home visiting service would be a program called the Healthy Family Service. Hamilton Center is contracted to provide that service through those Title V funds. Here in Greene County, we have really not had that service at all available to parents over the last at least 4 years. We have other services in the county that are trying to fill those gaps, or services like Healthy Start through Greene County General Hospital, Nurse Family Partnership, and Early Head Start. Those programs tend to run at almost capacity because we are not being provided with the federally required program, the Healthy Families Program through the Hamilton Center. Since 2020, we have reviewed 20 total cases of fetal and infant loss here in Greene County. 75% of those families were eligible for the Healthy Families Program. Over 53% of them were never offered that service because the service is wasn't here to be offered. Hamilton Center has a grant that lumps Vigo, Sullivan, and Greene County together, and the majority of those resources are being given to Vigo County, while Greene County children and families are left to not have access to those resources. Like I said, ultimately the data kind of speaks for itself. Our infant mortality rate, again, is the second highest, and our child fatality rate is the highest in the region.
I'm Sean McBride. I'm the director for the Indiana Department of Child Services for Greene County. I've been with the department since 2006. What I've noticed is lately, and we discussed it at our safety meeting we had at WRV last month, was that we're seeing a decline in services provided by Hamilton Center with therapists. There's a high number of turnover rates for Hamilton Center, so we had to contract out with different providers within the region and outside the region. So this is kind of lacking our ability to get therapists to work with children, work with families, and we just see this is causing a danger to our children in the Greene County area. So that's why we're seeing a downfall with Hamilton Center, and that's who our community mental health is, and our only community mental health in Greene County. We have the Bloomfield office and we have the Linton office. We talk to our clients. There's a large wait period to get to see our clients within Hamilton Center, and usually any services we have in home is usually virtual, none of it's in person, and so we have to contract out, so we see a lot of deficiencies with our services through Hamilton Center.
So my name is Ken Howard. I'm the assistant principal at Eastern Greene High School, and kind of here to talk about the way that has trickled into schools as well. So I do have a letter from our superintendent, Doug Lewis, that I would like to read, time permitting.
Sure.
Okay. Dear Commissioners, I hope this message finds you well. I'm writing to follow up on our recent request regarding mental health service support at Eastern Greene schools. As you are aware, our district has been left without a school-based mental health provider following the departure of Adult and Child Health, which had been successfully serving our students. Another agency had initially agreed to take over these services and even committed to hiring the same 4 individuals who were successfully working within our district, 1 therapist and 3 full-time skills specialists, 1 for each building. Unfortunately, after review by their administration in Indianapolis, that offer was rescinded due to concerns about contractual obligations related to CCBHC coverage in our area. Their leadership shared the following statement. It is with much regret that I must rescind our offer to provide Eastern Greene with clinical support services. As our higher-ups reviewed our offer, it was decided at the state level not to expand our current services to new locations due to CCBHC contractual obligations. It is believed that due to these new requirements, Hamilton Center should be able to meet the school's needs, and since they have an office in Greene County, our higher-ups do not want us to impede on their service area. To move forward, we submitted a formal request to Hamilton Center weeks ago asking for a letter of release that would allow another provider to serve our students. We have not received a response. Every day without this letter represents lost time, time during which our students are going without desperately needed CCBHC mental health support inside our schools. Below, and I will give this to you all at the end, I have included a screenshot from Hamilton Center's website which inaccurately portrays their involvement in Eastern Greene schools. In addition, the report shared with the commissioners in January also contains misleading information. Hamilton Center has not worked in our building since 2021. Their previous involvement ended due to repeated unmet promises and the consistent inability to provide the level of service our students, staff, and families require. I can only speak to Eastern Greene's direct experience with Hamilton Center, but I can say confidently that the services being reported are not reflective of the reality in our buildings. We are respectfully asking for the following: assistance in obtaining a letter from Hamilton Center granting permission for another agency to provide school-based mental health services at Eastern Greene. Accountability for the public funding allocated to Hamilton Center is also a key concern. Specifically, we are requesting, if possible, an itemized breakdown of how the $186,000 in county funds is being used to support residents here in Greene County. As a Greene County resident myself, again, this is Mr. Lewis, not me, I believe that it is essential that taxpayer dollars are used transparently and effectively with clear alignment to the purpose for which they were allocated to improve the well-being of our community. Our district remains deeply committed to supporting the mental health and well-being of our students. We are fully prepared to partner with any provider capable of consistently meeting the needs of our school community. However, in order to do that, we need the flexibility to bring in providers who can deliver adequate staffing, something we've not been able to secure from others, or we have from others, but have repeatedly been unable to obtain from Hamilton Center since 2011. Thank you for your time and for continuing to advocate for the health and well-being of our county's youth. So that is our message from Mr. Lewis.
To tack on to that, on Hamilton Center's website, it claims to provide these same services, wraparound counseling and case management to Bloomfield School District as well as Shakamak. I received an email from a representative at Shakamak when I asked about the services. And this email came in yesterday. To note, this, I believe, was brought to the commissioners 2 weeks ago, this concern with Hamilton Center. So we've been trying to talk to community partners about the services that they're receiving, or not receiving, and a representative from Shakamak shared, we are currently receiving case management and wraparound services. Our case manager is great. On the counseling side, it is hit or miss. The counselor frequently cancels the appointments, and up until this week, which would have been yesterday, so up until Monday, had not made an attempt to reschedule. This email tells me that, conversations have gotten out in the community, that community partners are concerned about the services or lack thereof by Hamilton Center, and now there's an attempt being made right on Monday morning to try to rectify after several months of not rescheduling these therapy services with children they are contractually supposed to be providing.
I asked at our last meeting, when a representative was here from Eastern, about the conversations with the Hamilton Center, and they said they hadn't had any for 4 years. Is there any possibility of that coming back?
I would have to defer to the letter that Mr. Lewis sent, in which he said they had contacted Hamilton Center and could not even get a response to a request for a letter of release.
I will say, Hamilton Center is invited to all of our fatality meetings, and Hamilton Center has not attended a fatality meeting since June 5th of 2024. They're also invited to all of our community action team meetings, which is open to anybody in the community, and they have not attended one of those since April 3rd of 2024. And I think there's some other discrepancies in the report. I don't have it in front of me, that was provided to the commissioners, just about being in attendance to things, right? Being aware. I think child protection team did not.
I think there's one time in 2024.
Yeah, so one time in the last 15 months that there's been a Hamilton Center representative. So we're not really getting access, but it's also been shared with us at the School Safety Commission that there have been several attempts by several different entities throughout the county to try to rectify the situation, and roughly quoting someone in that meeting, they said, we've attempted several times. Hamilton Center says we'll do better this time, and then we see influx in service, right, and access, and that lasts for a couple months, and then everybody kind of gets lazy on it again and stops paying attention, and then those services start to decline. So it seems like a revolving door over the last several years.
I will say, this is my first year in Greene County. The previous county that I worked in was in Indiana. It would be one that people would categorize as having a mental health crisis. The ratio of students to mental health care providers in that county was 852 to 1. As of the last date, I think was 2022 or 2023. In Greene County, it's 1,409 to 1. As close to 800 to 1. Monroe County is kind of tops in the state in that regard, I think because of IU, right? It's 300 students to 1. So we have fewer to go around, and with that understanding, the stewardship of the resources, I think, needs to be even held to a higher standard.
What would your ideal solution be?
For me, where I've been in other places, it's been a little bit more healthily competitive, right? So if a service provider is failing to meet the needs of the community, getting a letter of release, as was requested in Mr. Lewis's, letter to you all and to Hamilton Center, allows you to open up a little bit of that competition. I think one of the things that a lot of these mental health care partners have is they have the ability to get billable hours through Medicaid and things like that. So there are a lot of people who are eager to provide those services, not, I wouldn't say selfishly, right? It's part of furthering their mission to provide that support, but to also, bill hours that sustains their organization. So to me, it's a mystery when you see organizations with that opportunity and there's a clearly identified need in the community, then not kind of seeking those opportunities out. So I think the ability to look at other providers would be helpful.
The report also reflects it was provided to you by Hamilton Center that the Department of Child Services made one referral last year to Hamilton Center because they are having to use other service providers that are outside Greene County, and it's putting a strain on the providers that we have inside the county, as Hamilton Center is receiving a large chunk of taxpayer dollars to provide these services, and ultimately the department and others have to go to other resources that are not using taxpayer dollars to be provided these services. I would agree having access to other mental health providers, not worrying about having contracts or service area lines where other providers can't come in and compete would probably be ideal and helpful.
That is a legislative issue. Because we're set by the state, what we pay Hamilton Center, and their jurisdictional lines, that's set by the state. We have no control over that. So, I think it would be the best thing, most beneficial thing, to take this on up the food chain to our legislators. They're the one that make these rules. And they're the ones that can change these rules. And I feel like that's probably your best bet.
So
because, we've got a set of parameters that we have to go by. And if the lines for who can do what where, that's set by the state legislature. That's where we need to go to get a resolution. We can't do it at this level.
Is there an opportunity for the commissioners to hold accountable the money that's being spent and the services that are not being provided within the contracted area? If it's an act of legislation, that's going to take us a little bit. So what do we do now? Because kids are dying now, right? We can't wait until next legislative session to correct this problem. So is there a way to have some accountability on the local level by the commissioners for us to see an increase? I don't think that anybody's like, we don't want Hamilton Center not here anymore, right? If Hamilton Center can provide the service, that's great. We need the service. The problem is that there's been a lack of accountability on taxpayer dollars being spent and the services that we've been promised with that money.
Well, we get our annual report from Hamilton Center.
We made some notes on the report and put it in that folder for review by the commissioners.
Just from the outside looking in, there's a lot of services provided by the Hamilton Center. They do serve a lot of people. And I don't know what the other counties pay Hamilton Center because it's based on a percentage of whatever. I've got a little bit of knowledge about how much that care costs. And from the report we get for our 186,000 or whatever it is, they provide a lot of services in the county. I mean, the dollar aspect looks like to me that it's really good in our favor for what their annual report says. And I'm not just standing up for the Hamilton Center. Don't get me wrong. I mean, there's very few of us that can't do better than what we do, no matter what job or business we're in. You know, everybody could always do better. But for what we pay them and what they've provided for the county, at least in their annual report, we get a lot of value for our money. Now, whether or not they're missing this segment of people, whether it be students or whatever, they are providing a lot of service. And I don't know how all that equates out because they're a business. I understand that, and they have to stay in business. So I don't know how that all works out, but saying I'm not just standing up for the Hamilton Center, but from their annual report, we get a lot of value.
Well, if I could note in the annual report, there are a lot of things that are just not factually correct in the annual report, right? So services being provided at Eastern Greene, that's in the report, that's not accurate. Regular attendance at CFR, FEMR, CPT, Community Action Team, that's not accurate. My understanding in the report, it's claimed that they're providing services inside the Greene County Jail. My understanding is that's also not accurate. The jail is using contracted medical providers to do that. I mean, so I guess while the report may contain information that appears like you're getting the bang for your buck, there's also a lot of factually incorrect information in that report.
So let me speak to the jail. You don't work there. And I'm not here to bash Hamilton Center. Okay, but I did pull some numbers. Everybody comes into our facility has something. So I'm back and reviewed the last 3 years. I went into office in 2023. One of the first things I did see a lack of mental health. Requested a grant, got the grant, and we now have our own mental health people to provide service at the level we need it. But going back to the numbers, in 2023, Hamilton Center signed into our building $14 in a year. In 2024, they signed in 25 times. This year, they've not been there yet. It's been documented. They don't get behind those locked doors without signing in. So, again, it doesn't say how many times. It's very generic. Locations for addiction services. So have they been in our building? Yes, they do provide a service. And our facility is very limited. Okay, and part of, it's the main driving force for me to secure the grant for the ISA. Because we've got a mental health professional in our building 40 hours a week. We're serving, typically our jail runs about 110 inmates. All the evidence-based practices utilized in addiction treatment. It doesn't say they're doing them in our building, this is just what they utilize. My mental health person that works for QCC, through the grant, provides all these things. It's not provided in our facility by Hamilton Center. But this report is pretty generic. It doesn't say I do each and every one of these things in each and every location. That's why I want to speak about the jail, because that's the only thing I know about. I know in the past we've had a lot of issues with Hamilton Center when we needed somebody, a under previous sheriffs, they'd say, yeah, we come, but we're gonna send you an invoice, and they wrote us in. We had to pay them to come visit us, even though we spent all this money, so there's a lot of issues there. I know we still refer people to Hamilton Center upon release if there's a need. And apparently they take the referrals. I know they're active with our therapeutic justice program and our JRAC. Could it be better? Absolutely. But I don't live in a perfect world. I don't disagree with the commissioners. For what we pay them, they do provide a lot of services. The need was definitely a lot stronger in our facility, and that's why we went outside and, like you said, find a solution. Hamilton Center didn't offer, and I got a grant and provided mental health. So I don't know where they have a standing, Eastern Greene or any other school district, that's above my pay grade. I don't know if they have a legal, I don't feel like they have a legal right to say, Eastern Greene, you can't hire somebody to do this, but I may be wrong. I see the need for outside help besides Hamilton Center because the mental health issue is big enough. There's not enough Hamilton Center people that work in Greene County to cover. Thank you for your time.
And I understand the mental health issue is a huge deal in the county, we really do. But another thing is the lack of providers in the county is another huge thing. I mean, that's somebody who is in the process with dealing with a family member that is in need of mental health. I understand the lack of providers. The amount of time it takes to get an appointment, and not with the Hamilton Center. We're not working with the Hamilton Center. Just any provider that our insurance will pay for is, and we didn't limit ourselves to Greene County. You know, it's a problem everywhere. So I mean, I don't want you to feel like that we don't take this serious, because I do, because I have that need and can't get that need met. So I understand that frustration, but then the frustration is to the lack of those providers. I didn't mean to interrupt you.
That's all right. I remembered my question. You told us early on, you had 4 providers up at the school at one time, and I did not make a note as to who they were or who they worked for.
So this was adult and child, I might need to get a little help here, right? Adult and child was acquired by another company. That company ultimately opted to discontinue services to Greene County. To what degree that decision was financial, I'm not really sure. I'm not really privy.
That's what I was going to ask you. How did adult and child get paid before? Was it through Medicaid or?
Primarily. So they worked exclusively with Medicaid eligible students at our school. So for us, that doesn't get you necessarily everyone you want, right? But that gets a sizable chunk of the kids you want receiving those kind of services, those services at school. I mean, one of the issues that we have is that in Greene County, you've got, 1 in 20 kids is living in a home without a vehicle or private transportation. Right? So on top of the lack of providers, that's where that school-based service is so huge, either that or a home visitation wraparound service, because transportation is such an additional challenge.
And you're with IU, not Stone, whatever it is.
Centerstone, no, I'm with IU Health.
They're the sister company, you might say, sister outfit to Hamilton Center. That's what the state says.
Yes.
They have that area.
Yes,
Do they have personnel?
Centerstone?
Yeah, do they have personnel available for that?
Based on the offer that they made to Eastern Greene, it sounds like.
So Mr. Lewis's letter doesn't specifically name, right, the contractor that had initially offered and then rescinded services, because we could not get a letter of release, but that was Centerstone.
So they won't, if they had the people, they would commit to people because of the lack of a letter of release. Okay, letter of release doesn't release anybody from liability, it only releases them from money. Is that what we're talking about?
Basically gives permission for a provider outside that CCBHC coverage area to come in and provide services.
Okay.
So there is nothing stopping us from asking Centerstone to come in, right? But Centerstone as an organization may say, this area and the federal grant funding is all going to this particular provider to cover these counties, so we don't want to wander in there. And why that is, I don't know. I haven't worked in that field particularly, so.
Okay, thank you.
So have you actually talked to somebody from Catherine Hamilton, or is this just all emails and what's the reasoning for not doing the release? If they're not providing the services and you're saying they won't provide the release or they just won't respond to your request?
Mr. Lewis's letter says that he had contacted them. Formal request, I imagine that request was in writing. I can't speak to whether it was email or a letter. The formal request, and we did not receive a response. So that's as much detail as I have.
So that would improve your situation if we can get that release? Is that what you're asking us to look into, or what do you?
Yeah, I think assuming that Centerstone's offer would still stand, which I don't necessarily know, right, if that ship has sailed. But at one point, they were willing to come in if they had that.
But you're saying that Hamilton Center is providing you no services now, currently?
There is no Hamilton Center presence in our school, and it says that Hamilton Center has not worked in our buildings. That doesn't mean that maybe they aren't providing a service indirectly or outside the school since 2021. Yet, I'll hand this over to you guys at the end, right, there is a screenshot where it very prominently advertises at Eastern Greene Elementary School, we're here for you, counseling, skills training. Okay. But that's not been true for some time.
I'm sure we can get a response one way or the other from them as we send them some money.
Thank you all very much. I know it's not what you want to hear, but that's where we're at.
Do you have direction on how to address this legislatively?
Me personally, I would get a hold of my state representative and my state senator and tell them what your situation is and ask them if they would be willing to introduce legislation to remedy this situation. And if they're not, then I would go on up and talk to the governor's office.
I appreciate your time. Thank you.
Do we have any other public comments this morning?
I do.
Hi.
I'm Cindy Rotman. I'm with Hamilton Center here in Winfield and in Owen County. I would love to meet with these individuals personally. I've not gotten a phone call from any of them with their concerns. So I would love to do that. Also, would love to expand on the services in Eastern Greene that we're already doing. Every Wednesday, we have someone there in the middle school and the elementary school. And you can check your records. Her name is Tessa Baker. She has to go into the office, and she signs in, and then she goes to see the students. So we would be happy to expand on that. So I'm pretty sure you all got my number, cell phone number. If you don't, call the office. I know you all have my email, so let me know when you can meet. I'll meet with you guys individually. We'll address each concern, and we'll go from there. I did get a letter from Mr. Lewis on the 16th of March. I responded on the 16th of March that we're taking this up our chain and we're discussing it internally. He did ask if we would send a letter to Centerstone. I didn't understand why that didn't come from Centerstone to us as opposed to through a third party. So I don't know who their contact is. I do know that I also work in Owen County. We are not CMHC there, and our providers are in the schools there. So I'm not sure what the references to that either, so. Sorry to take up your time, gentlemen, but like I said, I haven't heard from any of these folks individually. And I would be happy to sit down with myself, my director, Monica Wallace, to figure it out. Thank you for your time.
Thank you.
Good. So let us know if you guys don't get to talk, okay?
Do we have any other public comments this morning? Discussion item this morning, I have county council redistricting.
Good morning.
Good morning, Jamie.
So, we are going to need to redistrict for the county council districts. We currently have 4. I mean, we'll stay with 4, but our population deviation from the 2020 census is at 24%, and we need to be down below 10% to meet state requirements.
We kind of knew this was coming.
Yep.
And, I mean, you've got all the numbers, so that won't be a problem.
No, she's already handed out precinct numbers and township numbers, so, yeah. We just need to crunch some numbers and draw some lines.
Yep.
And then Marvin will need an ordinance for that, correct?
That's correct. This doesn't require any formal public notice or public hearing. It can just be done. But it's always good to let the public know what you're doing and what's coming.
So, I would like to address that ordinance at our next meeting if nobody has any problem with that.
No, I'd like to get it done, so we can move ahead. I think it has to be done before June 30th.
Yes, it must be done.
Yeah. So, okay, we've all got our orders.
Thanks, guys.
Thanks, Jamie.
Thank you, Jamie. Commissioner Michael, do you have any announcements this morning?
I don't.
Commissioner Graves?
No, sir.
Our next regular public meeting will be April the 15th, 9:30 a.m. in this room. I would entertain a motion to adjourn.
So made.
Second.
All in favor? Thank you all for coming.